Jane, thank you so much for being at the Royal Society for Public Health conference today and for presenting the first Public Health Ministers Award.
Great pleasure.
It was at your instigation and it was a fabulous idea to celebrate. Can you tell me a little bit about why you think it's important to invest in health and well-being at the workplace?
Well, I mean, think how much time most people spend at work for a start. I mean, a huge amount of people's lives are spent at work if they're working age. And I think it's really important that we see public health as everyone's business, and so employers see it as just as much their business. And you know, it makes good business sense as well. I was very much influenced by working for the John Lewis Partnership before I went into Parliament. Very much a company that took the well-being of its members seriously. You know, many of the early kind of public health lessons I got were in the workplace, and it was much easier to deliver them in that context. You had people you could talk to about things. So I just think that it's an obviously good thing to do, but I don't think it's as universal as it might be, and anything we can do to encourage it and to celebrate good examples of it, then I'm more than happy to try and do that.
How are there other things you think we might do to encourage people to invest? Are there things that organisations like RSPH could do, or government, or
well,
others?
I mean, one of the things I think that's interesting is, I mean, we've obviously, we can celebrate excellence. I mean, there was an interesting speech recently by the Chief Exec of NHS England, of course, talking about tax incentives that are being used in America. So I do wonder if perhaps the Royal Society might want to look at international examples of different approaches that are used to incentivise employers and workplaces to do more. I mean, I'd find that very helpful to have that sort of overview of what's happening internationally and what's judged to be effective. But we also need to spell out the cost. It was great that you had John Cridland from the CBI here at the conference today at the awards, because it's a huge cost to business. It's not just that we want people to be better and to feel better and have better health. Actually, business benefits too. This is a win-win. We think £26 billion of cost to the UK economy just from mental health problems alone. I remember talking to somebody in the Royal Mail who said that they'd put something in my local sorting office, they'd put something in place in the run-up to Christmas to keep people healthier. And he was talking about how many more letters they'd got delivered because they'd been able to look after people in the workplace. So there's a real win-win here. Good for people, good for business, and I think more we can do to get that message across. But I am interested to look at some of those international examples.
And we will certainly have a look at that. I know that I've been reading about some of the work of the Cleveland Clinic and its wellness, and they've saved $15 million in the first year, but actually they've got a more energised workforce, and that's what they're most proud about. So we will look at that for you.
That'd be good.
I wondered about what you thought the role of workplace health champions might be. As you know, the Royal Society for Public Health has we've developed health champion qualifications and training so that people in all walks of life can understand more about how to improve health and help their peers. And I wondered if you thought there was a role for proper workplace health.
Absolutely. No, I think there's a big role. I mean, I think that what is important is that there is also senior level support for that. It can't be something that is just, I mean, you will have inevitably probably junior staff and people in different sort of parts of the kind of workforce who are responsible for the sort of person-to-person delivery of some of that. But it's really vital that I think you have a senior champion of that sort of programme, so that from sort of board levels, top of the organisation down, it's clear it's a priority. I've learned over the last year as a minister, I think the power of advocacy, and we forget that all too easily, and the power of advocacy for a senior leader in any organisation to say this really matters to organisation, and I will ask for regular reports and I will champion it and I will talk about it. I think that's really important. So you've got to have that leadership at the top as well as the people enthusing about it and delivering it at sort of shop floor level, if you like.
Thank you very much.
Thank you.